Good morning, everyone. We are from Group 3, and today we are going to explain about the biggest challenges of Taiwan's healthcare system it is facing right now, which is overcrowded emergency room and shortage of medical staff. So every year, tens of thousands of patients spend more than 24 hours waiting in the emergency room for a hospital bed. That's not just inconvenient, it's dangerous for the patients and exhausting for the staff. The main reasons are a shortage of nurses, limited ward of capacity, and the fact that many people go straight to the ER for minor issues instead of using clinics. This is happening due to Taiwan's national health insurance, which is a great success, but the way hospitals and doctors are paid is part of the problem. The system often treats all the services the same, so hospitals feel pressure to handle large volumes, while staff feel underpaid and overworked. This creates bottlenecks in emergency care, and nurses in particular are leaving the profession faster than new ones can be trained. This is an example of a picture of a ER crowding from Taiwan News.
Okay, so the government's response on the overcrowding ER issue is first, they approved an increase in funding. So the government approved NT dollars 4.25 billion injection into critical care to ease the pressure. And then the second one is healthcare investments. There's a broader plan, part of a healthy Taiwan cultivation plan of 48.9 billion Taiwan dollars over 5 years, comprising from 2025 to 2029 for improving working conditions in hospitals, training more healthcare specialists, and then introducing smart healthcare technologies, and etc. And then the third one, President of Taiwan Lai Ching-te proposed on reforming the payments model in the national health insurance system from one size fits all fee for service towards different pay for different work system. To this is to better attract doctors and adjust incentives.
So, what has already been attempted by the health minister? So, here are four examples of the action that has been taken by the Taiwan health minister to solve the national health issue. The first one is the expanding urgent care centers. Um, The centers are designed to handle non-critical but urgent cases like minor injuries, a case that don't really need the full ER treatment. The plan is to start pilot UCC program across Taiwan and will operate during weekends and holidays where ER are usually the most crowded. The second action is encouraging community clinics to open on holidays. Uh, this is to encourage community clinics to stay open during the time where ER are the most crowded. Uh, and the third action is geographic placement and radius rules. Each new urgent care centers must be within around 10 kilometers of a hospital that has a critical care capacity. This ensures that if a patient condition suddenly worsens, it can be transferred to a hospital quickly. And the last one is rebalancing copayment uh, incentives, where Co-payment is the small fees that patient pay when they receive care. Like, and under this new plan, UCC visits will have lower co-payments than major hospital ER visits.
Okay, so what else can we improve? First, we can use the early support discharge. Stable patient leave the hospital sooner to continue care at home, freeing bed for critical case. And second, we can implement telephone triage service. A patient can call a trained nurse or healthcare professional to assess their citizen before coming to the hospital. Finally, we should train public education. We can teach people when to, to visit the ER various clinics to reduce unnecessary visits and improve efficiency.
Okay. Also, what can we learn from Japan and South Korea from reducing ER overcrowding? The Japan's encourages early discharge for the stable patients, allow them to continue care at home or in outpatient clinics, which help free up beds for the critical cases. And the second, South Korea has clinics that handle minor urgent cases, especially during weekends and holidays, that reduce the burden on emergency rooms.
That's all from us. I hope you guys can understand why the issue on ER overcrowding in Taiwan is happening and what are the solutions to overcome it. Thank you for your attention.